So again, as we review our discussion last time, we've discussed about the rise of medication, the trump, if you can still remember, the right time, the right route, the right assessment, the right medication, and the right patient. We have also discussed the 12 rights of medication, which eventually uh, considered our discussion with situations that will mainly consider the clinical decision of uh, our future professionals. Now, actually, we have also discussed the different suffixes, which I know it has been an information overload for all of you, but I know that this could really prepare you of having the mastery of those suffixes, of medication suffixes, so that you can easily be connected and can relate to our discussion of various medications that will mainly consider in health conditions and diagnosis. So as what I have mentioned for today, we'll have a discussion on pharmacodynamics. When we considered pharmacokinetics, we have mentioned about the ADME and emphasized about the as absorption, distribution, metabolism, and excretion. Now, when when we talk about pharmacokinetics, it started with the administration site. It passed across the tissues and reached the systemic circulation. If you can still remember the AAS. Now, when we talk about pharmacodynamics, we are talking about how the drug is now distributed accordingly to its target organ. And when the patient is already, or the individuals have those medications that are having its reactions biochemically and physiologically in the body, these changes occur as pharmacodynamics. Actually, there are some basic terms that we consider in the use of the pharmacodynamics, and this will further help us on the classification of drugs and mainly will consider alignment of principles and concepts that will guide us on the classification of drugs. Actually, in the pharmacodynamic events, we will further discuss some of the receptors. I know I have already introduced to you receptors such as beta receptors, histamine 2 receptors. These are histamine receptors. These are receptors that are capable of transmitting the signal. And since we're talking about impulses, we will continue to discuss about receptors. So there are two basic terms that are associated with pharmacodynamics. We have the agonist and we have antagonist. If we say agonist, this will promote, this will consider stimulation of receptors. So for example, if we are aware of the beta 1 receptor, the beta receptor, we discussed that this will transmit impulses or signal to the heart to facilitate contraction. And if we encounter beta agonist drug, meaning the agonist itself is the one that will definitely guide you, that it will stimulate, it will promote, it will enhance, and it will uh, consider its movement. So agonist, so stimulate. On the other hand, the opposite of agonist is antagonist. I know you're familiar with villain in some of the movies. So antagonists are the contravidas. So meaning it counteract agonists, obviously. That's why most of the terms that we can associate with antagonists are inhibitors, blockers, um, those antagonists. So those, if drugs are what are those example of drugs that we have identified before? Calcium channel blockers. So it blocks the calcium channel to prevent decalcification. Beta blockers. So eventually, this considers the blocking of the beta one to stabilize heart contraction. Histamine 2 uh, blockers or antagonists, by which it blocks, it inhibit the histamine 2 so that not to stimulate production of hydrochloric acid. So again, with these terms of agonist and antagonist, we will now proceed to what I have mentioned to you, the mastery of the parasympathetic and the sympathetic nervous system. Okay, don't be overwhelmed. You really need to have a mastery of this, not just only memorize, because these are very basic for us to align our nursing responsibilities when you're about to administer certain type of drugs. So let's have an example. Parasympathetic, it means that the result of the result specifically of the drug, if it is parasympathetic, are all of this in the organs. In the sympathetic, if there are drugs that will act on sympathetic, it is expected that the drug will expected to have its effect on these organs. So can you give me an example, sir? An example basically is an anesthetic. Okay, can you still remember the suffix of anesthetic? We have the suffix cis or the suffix cocaine or cane rather cane. So most of the anesthetics, specifically I'm talking about the spinal anesthetics and the general anesthesias, has the effect specifically on the parasympathetic. Okay, when the drug will take its effect in the parasympathetic, it is expected that when you check the eye, it is expected to have constrict pupils. So mainly it can give you already the knowledge that the constriction of the pupil is brought about by the parasympathetic response of anesthesia. Another, most of the patients particularly will undergo major operations and will receive the induction of the spinal and the general anesthesia may lead to a possible stimulation of salivation. And the stimulation of the salivation may cause the possibility that it may lead to aspiration. And that aspiration will cause the possibility of obstruction of the airway passages. So it may block the airway and may cause possibility of alterations in gas exchange. So other than that, nurses need to monitor the patient after the major surgery and still with the next 2 hours of effect of anesthesia to monitor the first 30 minutes of post-surgery or post-anesthesia of every 15 minutes. The next hour, the patient will be monitored every 30 minutes and until every hour until stable. Why? Because we have been oriented. I've been in the operating room. We have been oriented that most of the anesthesia may lead to its effect on the inhibition of the heart to contract, and it may cause constriction of the bronchi. So it means that if there will be chances that the patient will have uh, an adverse reaction of the drug, it may cause the possibility of bradycardia and possibly may lead to shock. So it means that the patient may lead to possible cardiac arrest and may lead to death. That's why an overdose of anesthesia may lead to particularly sudden deterioration of heart contraction. Thus, the patient may lead to cardiac arrest. Other than that, we have we have the bronchi. The bronchi is associated with the respiratory function, and it's a passageway for the ventilation and the gas exchange. However, because of the effect of the anesthesia, we need to monitor the patient for chances of respiratory shock or arrest. To the extent that since it will cause constriction, it may cause limitations of the entry of the air in and out of the body. So if the patient will have adverse reactions of the anesthesia, the chances that the patient may lead to respiratory arrest. So that's why it is very important for you to consider that the effect of anesthesia may lead to this, and your nursing responsibility is to definitely monitor the patient. Another, why the patient are instructed or why the nurse will prepare the patient in a major operation to be an empty stomach or to instruct strictly with nothing per orem. Simply because when the patient will be inducted with anesthesia, it will cause stimulation of digestive activity. And automatically, if there will be stimulation of digestive activity, it may cause the possibility of what? Stimulation also of production of hydrochloric acid. So in this situation, if ever the patient is in full stomach and was brought to the operating room for a major surgery and then receive induction of anesthesia, then may lead to stimulation of digestive activity, there could be a possibility that the increased hydrochloric acid may irritate the upper GI and thus may cause a possibility of induction, or it may induce vomiting. And that vomiting may cause the possibility of reflux of the gastric content, and thus if the patient vomits and the patient is unconscious because of the anesthesia effect, it may cause the possibility of aspiration and may block the airway passages. That's why most of the patients are in nothing per orem once the patient will receive an induction of anesthesia. And other than that, if the patient undergone a major surgery, even after the operation, that may cause also a possibility that the patient unconsciously may vomit and the nurse must monitor and may lead to possible aspiration. Other than that, most of the patients who may have received anesthesia with a parasympathetic effect, there will be a decrease in the impulse transmission of signal and urge. Once a patient is full, the bladder of the patient is full, she or he may not feel the urgency of passing the urine or the fullness of the bladder. That's why most of the patients who undergone the operation with the mentioned anesthesia, it may cause the possible contraction of the bladder. It will cause the urine to retain in the bladder. So that's why most of the patients who undergone the operation will be subject for insertion of Foley catheter, not just only for purposes of draining the urine because the bladder is contracted, and we all know that if the bladder will be contracted, it will cause the overstretching of the what? The bladder muscles. And the overstretching of the bladder muscles may cause the possibility of tissue injury and damage. So basically, to prevent that, the patient can be inserted with a Foley catheter, or the patient can be inserted with straight catheter just to empty the bladder, because we all know that it may cause further retention of fluid in the bladder. So these are situations why you really need to consider the concept of parasympathetic and have the mastery in pharmacology. Let's set an example for sympathetic response. When you attend to a patient in the emergency room, obviously when a patient experience cardiac arrest, you will need to revive the patient. Okay? You will definitely perform cardiopulmonary resuscitation. And in the performance of the cardiopulmonary resuscitation, we need also to administer emergency drugs. So one of which, since cardiac arrest, so we need to have stimulation of the heart to contract. And that drug, particularly, is epinephrine. If the drug has been administered to the patient, the effect of the epinephrine is sympathetic. So when you assess the patient's eyes, it is expected that there is dilated pupils. Next, um, the patient who is receiving sympathetic drugs such as epinephrine may lead to dryness of mucosa. That's why when the patient receive multiple dose of the epinephrine, it may cause the chances of dryness of mucosa and may have chances also of injury of skin tissue injury. So that's why there is a need to maintain the moisture of the oral mucosa. Then, other than that, the response of the sympathetic is opposite with the parasympathetic. It opens the airway and it increases the heart rate. So that's why sympathetic response, if you've heard, oh, this is a sympathetic drug, what is the effect to the heart? So obviously, it increases the heart rate. Other than that, sympathetic response may cause also the chances that the patient may inhibit digestive activity. So meaning there will be a decrease in the production of the hydrochloric acid and other metabolic activities. So obviously, other than that, other than the drug and the epinephrine that you have administered, the the sympathetic response of the epinephrine may cause a possibility for the adrenal glands to stimulate secretions of catecholamines, the epinephrine and the norepinephrine. So, in this perspective, you can now be aware on how you will connect, okay? How you will connect the concept that when a drug has a sympathetic effect, you can have a reference of the effect in these organs, and eventually you can consider a care management or intervention that when the patient is receiving a type of drug that is under the sympathetic, you can now consider the expectations on assessments such as dilation of pupils. If there's inhibition of saliva, there could be chances of um, dryness of the oral mucosa. If the patient will consider relaxation of or opening of the bronchi and increased heart rate, you need to monitor the vital signs if the patient is improving. Since the patient is connected, even though in a cardiac monitor, but the nurse might still consider the continuous checking of the vital signs. So these are the implications why you need to basically have the mastery of parasympathetic and the sympathetic nervous system. Okay? So, do you have any questions? If you don't have any questions and the discussion or the implication of the sympathetic and parasympathetic is clear, can I see thumbs up from our students? Thank you so much. So meaning this part of the discussion is clear. So again, if you have any inquiries or questions, our chat box is open. It's open to post your questions and queries. You can unmute. You can unmute basically or raise your hand so that you will be acknowledged or recognized. Okay? So again, as what I have mentioned, we need to consider specifically the perspective of having the mastery for parasympathetic and sympathetic nervous system. To continue, this could be your reference on how you will further have classification of drugs. So on the next uh, slide, it will project certainly on the sum of the terms that are being used in drug classification. Okay, let's start. For parasympathetic nervous system, other term for parasympathetic is cholinergic. The major neurotransmitters for parasympathetic is acetylcholine. Kaya whenever you will encounter acetylcholine enhancer, so always associate acetylcholine with parasympathetic, cholinergic drug. So it means that the cholinergic can be associated to the parasympathetic. But again, if we will use acetylcholine blocker, what does it mean? Since it blocks the acetylcholine, it's not anymore in the parasympathetic. It's already sympathetic. Why? Because it blocks the parasympathetic response. So if we say cholinergic antagonist, antagonist meaning to inhibit or block. So you inhibit the cholinergic. Will it still follow through the response of the parasympathetic? Not anymore. That will consider the effect of the sympathetic. So let's discuss this one by one and have it simplified. On the sympathetic, it is also called as adrenergic. And the major neurotransmitter or receptor is norepinephrine. So again, if you will encounter a drug such as adrenergic agonist, agonist meaning stimulate. Once you stimulate adrenergic, the response is sympathetic. Another example, norepinephrine enhancer. For norepinephrine enhancer, you enhance, meaning you stimulate. Okay, you stimulate norepinephrine. So obviously, the result is on sympathetic. Now, if we will use naman adrenergic antagonist, Okay, let's go back to the term antagonist. The antagonist is mainly inhibit. So it's not anymore sympathetic because you already inhibit adrenergic. That brings to parasympathetic. So let us discuss it by one. We have let's start with parasympathetic. With parasympathetic, we have the parasympathomimetic drug. It means the term mimic. Mimic meaning it follows, it signify mimicking the function of the supposedly compensatory mechanism, the natural response of the body. So pag parasympathomimetic drug, it mimics parasympathetic, it's parasympathetic response. Next, if you will encounter drugs that has lytic, okay, and what are those drugs? Those drugs that could be associated with lytic are anxiolytic, mucolytic. Okay, with the mucolytic, it means lytic. It inhibits mucus secretion. Anxiolytic inhibits inhibits the further occurrence of anxiety. So those are lytic. Okay, lytic. So meaning it contradicts. Okay. If you will encounter sympatholytic drug, okay, it contradicts sympathetic, then that's parasympathetic. Now, very obviously on the third, cholinergic drug. So other term for parasympathetic is cholinergic. If you will encounter cholinergic drug, it's parasympathetic. There are drugs also that uses anti. Okay. If it uses anti, obviously it counteract. Anti-adrenergic drug. So meaning it counteract the results or response of adrenergic. You don't need to memorize all of this. All you have to do is to analyze every classification of drugs and explain with the use of anti, with the concept of lytic, mimic. That will guide you further on this classification. And the agonist and antagonist as well. So for example, cholinergic agonist. For cholinergic agonist, if we say agonist, promote, stimulate, and cholinergic is associated with parasympathetic. So that's why it's more on parasympathetic. If it is cholinergic antagonist, it contradicts cholinergic, kinontra niya ang parasympathetic. So ibig sabihin, pag kinontra ang parasympathetic, we are giving responses on sympathetic. So that's why it's very important to know when agonist is used, when cholinergic is used, this will give you a guide and reference to interpret it. Simply interpret it. Adrenergic antagonist. So we have used antagonist. It inhibits the adrenergic. Adrenergic is sympathetic. So if it contradicts the sympathetic, it's parasympathetic. Cholinergic enhancer. Cholinergic is associated with parasympathetic. Enhancer, it stimulates. So if it stimulates cholinergic, parasympathetic response. Adrenergic inhibitor. If we say adrenergic inhibitor, it inhibits the adrenergic. It inhibits the sympathetic. So it contradicts effect of sympathetic, then it's parasympathetic. Similar also with inhibitors, blockers. So that's why antagonists, inhibitors, blockers, these are terms that are being used or in most of the drugs to counteract. Okay, to counteract receptors, to counteract its effect. Yeah. So if you will see also in the sympathetic, on the other hand, it's the same. Adrenergic drug, because it's associated with with sympathetic. Anticholinergic drug, because it contradicts cholinergic. Cholinergic is associated with parasympathetic. So kinontra mo si cholinergic, then it's sympathetic. Sir, how about kung if we say acetylcholine agonist? Okay. Kung acetylcholine agonist, acetylcholine is associated with parasympathetic, agonist stimulate. So meaning parasympathetic siya. Kung norepinephrine agonist, okay, norepinephrine associated siya sa sympathetic, agonist stimulate. So in-stimulate mo ang norepinephrine associated sa sympathetic. On the other hand, baliktarin naman natin. Acetylcholine blocker. It blocks acetylcholine. So kung binlock mo yung acetylcholine, binlock mo yung parasympathetic, ang result niyan sympathetic. So, kung halimbawa naman acetylcholine enhancer, so sa parasympathetic siya. So, similar also with norepinephrine blocker, binlock mo yung norepinephrine, so sa parasympathetic yung action nun. So, kung ginawa mo ay norepinephrine agonist, then it stimulates norepinephrine, it's sympathetic response. So, I think these terms will really guide you, specifically as we started with the concept of agonist, antagonist. You will encounter this when you try to have a drug handbook. Okay, this will really guide you if you have the drug handbook and interpret it on your own. Next. Now, when it comes to the pharmacogenomics, we have reiterated in the perspective that each one of us may have different response to drugs. Male, female, child, adult, elders. Because each one of us may have different metabolic response, physiologic activities. This will greatly associate with the response of drugs. However, there were also inherited traits that will mainly put risk patients when taking medication, such as if the patient has history of inherited traits such as asthma. So meaning the client is prone on hypersensitivity reactions. How about if the patient may have also inherited traits of thalassemia? So thalassemia is usually a disease, a disorder that mainly be inherited and may cause anytime patient on bleeding. So this may also counteract the results of drugs because we all know that drugs must really reach the plasma. If there is bleeding, it will greatly affect specifically the distribution of the drug. So again, these are pharmacogenetics. Let us now proceed with pharmacotherapeutics. Okay? We have defined pharmacotherapeutics as the use of drug, of meeting the treatment, the side effect, yun. Now, we have defined in the previous discussion all about if you have watched the video presentation in relation to what is onset of action and what is duration of action. I think we have discussed this. In the onset of action, it's usually the beginning of therapeutic effect. And if you say duration of action, it is the length of time of the entire results of the desired effect. So when we are talking about desired effect, it includes the following. So these are I know these are the some of the terms that you have encountered possibly. Okay, you have encountered possibly when you are administering the drug or you're assisting your parents or your relatives in the medication administration. So let's start with number one, empiric. Okay, if we say empiric, um, the patient the patient is taking the drug but still under observation. On to what extent? For example, vaccines. The vaccines, if you are aware of the literature of vaccines that we have now, it's still on clinical trial 1, or rather 3. If we say clinical trial 3, the trial is being done on mass number of individuals or population. That's why, as what we have discussed before, any individuals receive the vaccine, you need to be observed for any adverse reactions because they need to have this recorded. Then once all of these observations in the span of time of study are very evident that there will be no harm to individuals, then that will be the time that it will be commercially be distributed, and that will pass through clinical trial 4. So still, if we are considering this for observation, that is empiric. Another, there are situations also by practical experience. Yung for example, if you're aware of mga supplemental medicines, na aware naman kayo sa mga ito na no approved therapeutic claims, but somehow based from the practical experience of the patient, they may claim that they have been treated uh, with the drug. Pero again, it may need further it may need further support or scientific studies kasi pag ang isang drug ay hindi pa nakakakumpleto ng support for the evidences that it's safe, that will still be under empiric. So yun po yun. Another, those companies who are having experimental studies for safety of drugs. So yan po, for empiric po yan. So next po, number 2, ano naman po yung tinatawag nating supportive? If we say supportive, the term being used is sustain. So for example, the patient is not known hypertensive. So the patient experiences hypertension and there's a need to stabilize the blood pressure. So hindi siya hypertensive, so it does not treat cause. So mainly, it will consider po yung circumstantial that the patient experience hypertension, then to sustain the normal blood pressure, the patient may have uh the what to call this, the antihypertensive drug. Example, may mga patient din naman na hypertensive pero may mga drugs that are being taken by the patient pagka your blood pressure is 160 over 100. Okay, above 160 over 100. Ibig sabihin, if above 160 yung systolic, above 100 yung systolic, that is the time that the patient may take the drug. So ibig sabihin, below than that is still controlled. Okay? So dun tayo sa maintenance. Pero pag it may increase 160 over 100, that's the time that it may need to have supportive drugs. Okay? So another situation, patient naman is not known diabetic, pero eventually uh, the patient has a sudden increase of the blood sugar. So those are the situations that will really need to manage because it may lead to a possibility of complication. So ano yon? Supportive to sustain. So, yun yung mga circumstances na masasabi nating supportive kasi it supports certain situations that may need management of drugs. So, yung mga emergency situations, ayan emergency situations could be supportive kasi kung ang patient mo not known hypertensive, walang maintenance, then you need to give the drug to support yung management of blood pressure of a certain cause. So, yun na nga, kung for example, the patient is not known diabetic, pero there's a sudden increase in the blood sugar, so you need to support until stable. So, the patient, once stable, then stop na yung gamot or discontinue na yung gamot. Okay? Similar also with situations na if the patient has the result in diagnostic examination of electrolytes na uh, mababa ang potassium. The medical term for that is hypokalemia. So, the patient can just have a supportive drug to sustain yung pag-stabilize ng potassium. Pero once stable na yung potassium, stop na ang drug. Kasi this may cause the possibility na mag-lead naman sa hyperkalemia. So, those are the situations that may consider only to sustain. Okay? To normalize. Okay? Next, ano naman yung palliative? If we encounter palliative, these are situation na ang situation or health condition ng patient ay nasa end stage na siya, um, outside hospital na siya, in a specific facility na po siya. Example lang po, if the patient has been diagnosed with cancer and at the same time stage 4, so end stage na siya. So end stage, sa stage 4, there could be possibilities na may mga situations of type of cancers that are not responsive anymore with chemotherapy. So since it's already end stage and it may not carry specific treatment, yung conventional treatment may not be anymore responsive sa patient. So yung i-consider na lang natin, we will alleviate yung mga symptoms-based approach na tayo. So most of the patients who have cancer may experience pain. So ano na lang yung pwede natin i-support? So isusupport na lang natin doon is pain management. So we could have non-pharmacological but moreover pain relievers na lang. Pero the pain relievers may not merely treat the end stage or the terminal condition of the patient. Another, ang patient mo is on the end stage of the renal failure or failure of the kidney. So there could be chances that the patient may or may not undergo any more uh, dialysis. However, the patient could be risk of bleeding. So that's why there could be chances as a palliative to prevent bleeding, the patient may receive drugs just to alleviate the situation. But it doesn't mean that it may treat the end stage renal failure. So yun yung ano natin for the palliative care. Ito yung mga usually yung outside hospital who are staying already in sa mga hospice care, yung mga bedridden na na hindi na conventionally tinitreat sa hospital, nasa home care management na lang. They're receiving support na lang ng palliative management or pharmacological management on a palliative purpose. So yun po yun. So, lalong-lalo na those situations sa mga, near end of life care. So, eto hindi na nagiging aggressive, yon should we say, the treatment is not anymore aggressive, but the point is, the approach is only on the alleviation. Next is maintenance. Eto, this is the term that is basically very familiar with you. Eto naman ang difference niya sa supportive, those individuals may not be known for a particular chronic illness. Etong mga maintenance naman